Gonorrhea. Gonorrhea is a commonly sexually transmitted disease that is caused by the bacteria Neisseria gonorrhoeae. It can grow in warm, moist environments in the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and the urethra in women and men. The right treatment can cure gonorrhea. Talk to your healthcare provider. Have an open, honest conversation with your healthcare provider about the sexual history and STI screenings. If you're not comfortable with your regular healthcare provider about STIs, there are many clinics that provide confidential and free low-costing testing, like the healthcare department in Ionia. The different types of gonorrhea are urogenital, which are including the urinary and genital organs, extragenital, which are outside the genital region or organs, and then disseminated gonococcal infection, which occurs when the infection invades the bloodstream. Some doctors that specialize in treating these diseases are OBGYN doctors, infectious disease doctors, your primary care provider, or a urologist, which treats urinary tract diseases. The diagnosis can be found by a healthcare provider testing a urine sample for gonorrhea. However, if you had oral or anal sex, your healthcare provider may use swabs to collect samples from your throat or rectum. Treatments and medications include monotherapy with a single intramuscular dose of ceftriaxone, 500 milligrams. If not possible, then EPT via a single dose of 800 milligrams of cefixamine should be considered. Some prevention measures include using a condom if you have sex, limit your number of sex partners, be sure you and your partner are tested for sexually transmitted infections, do not have sex with someone who appears to have sexually transmitted infections, and consider regular gonorrhea screening. Sexually active women younger than 25 and men who have sex with men are increased risk of getting gonorrhea. Other factors that increase your risk include having new sex partners, having sex partner who has other sex partners, having more than one sex partner, and having had gonorrhea or other sexually transmitted infections. Untreated gonorrhea can lead to major complications such as infertility in women, infertility in men, infection that spreads to the joints and other areas of the body, increased risk of HIVs and AIDS, complications with having babies. Signs and symptoms in males include painful urination, discharge from the tip of the penis, pain or swelling in one testicle. Signs and symptoms in women include increased vaginal discharge, painful urination, vaginal bleeding between periods, such as after intercourse, abdominal or pelvic pain. And then here is a picture of the signs and symptoms in women and men. And then there is the bacteria that causes the disease. Here's also a picture of the bacteria that causes the disease. This is what it looks like on the skin. And then this is the amount of cases by state. So the more red it is, the more cases there are in that state. And then some fun facts include gonorrhea is the second most commonly reported notifiable disease in the United States. And it is estimated that approximately 800,000 people in the United States are infected with gonorrhea each year. Only about half of these infections are reported to the CDC. And in Iowa, there were 1,966 cases reported in 2011. And then these are just some microbes.